Fluid and electrolytes. 1. A patient diagnosed with hypocalcemia develops a carpopedal spasm after the blood pressure cuff is inflated. This finding indicates E. Positive Trousseau sign. B. Positive Chvostek sign. C. Tetany. D. Paresthesia. Answer is option A. Positive Trousseau sign. A positive Trousseau sign, carpopedal spasm that develops usually within 2 to 5 minutes after applying and inflating a blood pressure cuff to about 20 mm Hg higher than systolic pressure on the upper arm. It happens because blood supply to the ulnar nerve is obstructed. Chvostek sign, twitching of the facial nerve when tapping below the earlobe. Paresthesia means numbness or tingling. Features of tetany are tingling in the tips of the fingers around the mouth, and muscle spasms in the extremities and face. 2. In a patient with history of chronic obstructive pulmonary disease, which is the client's primary stimulus for breathing? E. High PCO2. B. Low PO2. C. Normal pH. Normal bicarbonate HCO3. Answer is option B. Low PO2. A chronically elevated PCO2 level, above 50 mm of mercury, causes inadequate response of the respiratory center, so the major stimulus to breathing then becomes hypoxia, low PO2. 3. Which electrolyte would the nurse identify as the major electrolyte responsible for determining the concentration of the extracellular fluid? E. Potassium. B. Phosphate. C. Chloride. D. Sodium. Sodium is the major cation in extracellular fluid. Potassium is the major cation in the intracellular fluid. 4. Which is the drug prescribed in hypokalemia? E. Potassium supplements. B. Kayexalate. C. Calcium gluconate. D. Sodium tablets. Answer is option B. Kayexalate. Kayexalate is a cation exchange resin. It can be given orally, by nasogastric tube, or by retention enema. Potassium is drawn from the bowel and excreted through the feces. 5. Joshua is receiving furosemide and digoxin. Which laboratory data would be the most important to assess in planning the care for the client? E. Sodium level. B. Magnesium level. C. Potassium level. D. Calcium level. Diuretics such as furosemide, Lasix, may deplete serum potassium, leading to hypokalemia. In a patient taking digoxin, hypokalemia may potentiate digoxin toxicity. 6. Aldosterone secretion in response to fluid loss will result in which one of the following electrolyte imbalances? A. Hypokalemia. B. Hypokalemia. C. Hyponatremia. D. Hyponatremia. The answer is option A. Hypokalemia, when aldosterone is secreted in response to fluid loss. It causes sodium reabsorption and potassium elimination. It results in hypokalemia. 7. For IV replacement of potassium for a patient with severe hypokalemia, which of the following option is right? A. By rapid bolus. B. diluted in 100 cc over 1 hour. C. Diluted in 10 cc over 10 minutes. D. IV push. Answer as option B, diluted in 100 cc over 1 hour. Potassium must be diluted and given slowly. Rapid administration will cause cardiac arrest. Fluid and electrolytes. 8. Respiratory regulation of acids and bases involves E. Hydrogen. B. Hydroxide. C. Oxygen. D. Carbon dioxide. Answer as option D, carbon dioxide. Respiratory regulation of acid-base balance involves the elimination or retention of carbon dioxide. 9. Normal serum sodium concentration ranges from A. 120 to 125 MEq, Lb. 125 to 130 MEq, Lc. 136 to 145 MEq, Ld. 140 to 148 MEq, L. Answer as option C, 136 to 145 MEq, L10. The pH of 7.46 as indicates A. Acidosis. B. Alkalosis. C. Homeostasis. D. Neutrality. Answer as option B, alkalosis. Alkalosis is indicated by a pH above 7.45. Acidosis is indicated by pH below 7.35. Thank you for watching.